Jangan 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 teriak-teriak ya, Tobi.
Ladies and gentlemen, welcome to THQA Taiwan Healthcare Qualities Association, the ESQA Joint International Webinar. Today our topic is focused on hospital management. Next page. I'm Wei Chun-Huang as Chairman in International Cooperating Committee in Taiwan Healthcare Quality Association. Next. Our association is focused on improve the quality care in Taiwan healthcare. Next. So we organize several international webinars with ESQA. Next. And also other Joint Commission of Taiwan and other society in Taiwan. Next. If you have any question, please leave your message at the Slido. Next. First, I will introduce our president in Taiwan Healthcare Quality Association and also superintendent in Fuyin University Hospital for deliver opening remark. Let's welcome Professor Shao Yuzhen.
Good night to all healthcare quality members and the professionals. I'm a president of the THQA, Taiwan Healthcare Quality Association, Dr. Zheng Shaoyu. We are very happy to invite two experts in healthcare qualities. One expert from Indonesia is Hanny Handjaja Ronosulistyo. He will give us a topic of the challenges and the perspective for Indonesia's hospital in the 2025. And another is from our Taiwan Chang'an Memorial Hospital, Vice President Dr. Wu Junde, Professor, to present the new formula healthcare workplace, talent developments, retention strategies, friendly workplace, as the THQA ASQUA's International Joint Video Seminar hosted by the International Cooperation Committees of the Taiwan Association for Quality in Healthcare. From the two speeches of these two experts, we were understanding the changing in the healthcare environment and the challenges faced by the healthcare structures, in particular the advance of the AI era, where changes will pursue the medical quality and the patient safety. Let us wait and see and listen to these speeches. Tonight, two experts will bring us these two topics will definitely give us new concepts and ideas. I look forward to everyone participating in and enjoying these speeches. I also wish everyone have a happy Chinese Lunar New Year's. Thank you.
Thank you, Professor Zheng. So next, we will invite Professor in National Taiwan University College of Medicine, Professor Shi Zhizhen, as a moderator for next to speak. Professor Chen, please.
Thank you. President Shao Yuzhen, Taiwan Healthcare Quality Association, and all the members of the Research Society and also ladies and gentlemen. Good evening. It's my great honor to introduce the next speaker is from Indonesia, is Dr. Handjaja Ronosulistyo. He graduated from the unpaid Faculty of Medicine in 1978, and also the Faculty Post Bachelor unpaid 1987, and received the unpaid postgraduate faculty major in OBS GI1 in 2014. Now he is the head of the Division of Foreign Affairs and the Inter-Organization Relationship Indonesia Hospital Association. Also the head of the Division of International Accreditation and Foreign Affairs CARS, KARS. Now he is the board member of the ESQA since 2022. and also the board member of the ASQA since 2020, and the board member of IHA since 2022, and also the board member of the AHHA since 2022. Today, he will give us a very interesting topic, is the challenge, and the prospect for Indonesia hospital in 2025. Let's welcome Dr. Handjaja Ronosulistyo.
Dear ladies and gentlemen, dear doctors and professors, I'm very honored to be invited to this honorable meeting, and I'm going to present about the challenges and prospects of Indonesian hospitals in 2025. I'm Dr. Hanny Ronosulistyo. I'm obstetrician and board member of the ISQA. Together before with Professor Pa Chun Wang. This presentation is much influenced by the programs of our MOH. The agenda align of the desired health outcome by drawing insights from international benchmark and guidelines, current health outcomes in Indonesia, and upcoming health priorities in the nation. Second one is aligned on strategic indicators, ISS, tailored to address Indonesia's specific health challenges, enabling accurate measurements of progress towards each health outcomes. The third one is to agree on priority programs tailored to Indonesia unique context designed to effectively achieve the desired health outcomes. And conclusion. Introduction, as you know, Indonesia is a very large country. We are number 4 populated in the world, with 2000, maybe now 2000, about 2008, 280 million people, a little bit lower than the United States. We have 3,200 plus hospitals and growing every year, and 11,000 plus health centers growing every year. We also have, luckily, universal coverage by BPJS, who is covering already 96% of the people, and about 90% of the hospital is joining this universal coverage system. By this, we are going to identify our challenge and proposing in 2025. So we use the global guidelines, and we have 4 teams to compare: lifestyle and community, and population. Second one is health resilience and preparation. The third one is accessibility, quality, and affordability. And the fourth one is health system, policy, and governance. And we compare with global guidelines, just like SDGs and WHO. We also make benchmark with other countries. Here's Australia, Malaysia, India, China, Thailand, and Japan. Maybe not all the newest program, but this is what we get. So then we access the global best practice benchmark against our MOA's health outcomes 2024 to 2024, 2020 to 2024. So it's just finished, and now we are on 2025 to 2025, 2029. So what's the topics is improve mother and health, family planning and reproductive health first, then accelerate the improvement of community nutrition. Second one. The third one, healthy movement culture. Fourth is improve disease control, and fifth is strengthen health system and drug food control. So what's our steps towards a future health priorities? Is 5. First one is a healthy and reproductive population across all stages of life. Second is future pandemic resilience and preparedness. Third one is accessibility, availability of and quality healthcare. Four is risk management and financing optimization. And fifth is health system and technology. So for discussion, we have 5 key health outcome, and our proposed outcomes for 2025-2029 is ensure mental health problems. Halo?
Halo, selamat siang.
Ya.
Iya, dokter mohon maaf mengganggu sebentar nih dokter, kenalkan dokter.
Mbak, saya lagi rapat, saya lagi presentasi ini mengganggu. Jangan telepon sembarangan gini. WA dulu baru telepon, nggak sopan ya. Luckily, universal coverage by BPJS was covering already 96% of the people, and about 90% of the hospital is joining this universal coverage system. By this, we are going to identify our challenge and proposing in 2025. So we use the global guidelines, and we have 4 teams to compare lifestyle and community and population. Second one is health resilience and preparation. The third one is accessibility, quality, and affordability. And the fourth one is health system, policy, and governance. And we compare with global guidelines, just like SDGs and WHO. We also make benchmark with other countries. Here is Australia, Malaysia, India, China, Thailand, and Japan. Maybe not all the newest program, but this is what we get. So then we access the global best practice benchmark against our MOA's health outcomes 2024 to 2024, 2020 to 2024. So it's just finished, and now we are on 2025 to 2025, 2029. So the topics is improve mother and health, family planning and reproductive health first, then accelerate the improvement of community nutrition. Second one, the third one, healthy movement culture. Fourth is improve disease control, and fifth is strengthen health system and drug food control. So what's our steps towards future health priorities is 5. First one is a healthy and reproductive population across all stages of life. Second is future pandemic resilience and preparedness. Third one is accessibility, availability of and quality healthcare. 4 is risk management and financing optimization, and 5th is health system and technology. So for discussion, we have 5 key health outcome, and our proposed outcomes for 2025-2029 is ensure mental health problems. Hello?
Hello? Is the speech finished?
Sorry, the video is, I think, disturbed. What
Thank
shall
you.
we
Thank you
do?
so much. So we will go on to the next speech. Professor Chen.
Okay, now we proceed to the next speaker. Dr. Wu Junde is the Vice Superintendent of Linkou Changgung Memorial Hospital. Professor Wu graduated from the Taipei Medical University and received PhD degree from the Clinical Institute of Medicine at Changgung University. Today, he will give us a topic is the new formula for healthcare workplace, talent development and retention strategy, and friendly workplace. Dr. Wu, please.
我先关不掉。
Thanks, motivator Professor Chen, President Zhang of THQA, and Chairperson Professor Huang of International Cooperation Committee of THQA. Good evening, esteemed colleague and member of THQA. I'm Chun-Te Wu. Today, I'm very great honor to speak with you as a part of Medical Quality Library. I would like to share you with today our new formula of healthcare workplace. Changgung Medical Foundation encompasses 12 hospitals and 1 operation alliance. We have 27,000 employees and serve over 11,000 beds. Our approach is comprehensive and innovative. This is the landscape of Linkou Changgung Memorial Hospital. This hospital has 3,488 beds spread over 300,000 square meters. We provide a service for about 2.7 million people a year through inpatient, outpatient, and emergency service. Our organization is the largest and the most comprehensive health service in Taiwan. This is our organization chart. We have integrated various departments and units to uphold our mission, value, and vision. This strategy supports our for both current operation and the future development plan. Our mission is to promote our patient health, and our value is benefit mankind. Our vision is to be a premium healthcare organization. Service, education, research play a crucial role in healthcare institutions, complementing each other to drive medical advancement and innovation. These 3 pillars contribute a sustainable development of Changgung Memorial Hospital. How to implement our vision? This diagram shows a 2-way operation model, where top-down promotion, and bottom-up reporting, ensuring effective implementation and continued improvement. Our ESG implementation includes several key actions. Socially, we promote social good and foster social inclusion. We also recognize the importance of our most valuable asset, that is our employees. Physicians, nurses, medical technicians, and administration professionals. Our professional framework emphasizes professional growth and career development. Chang'an provides a professional promotion system for attending physicians. They can go through academic track, become a professor. Or they can go through the educational to become a physician educator. They can also go through research, physician scientist. We also provide a structured administrative career path for attending physician. The attending physician can join a committee intra-hospital or inter-hospital to become the chief of division. And thereafter, they will train like a chairperson of committee. Then they can promotion to the chair of department and become more training and leadership development. They can promote to the vice superintendent or even superintendent. This is the nursing career development track. After training to the N4, they can choose become the administrative, clinical nurse specialist, educational track, research track, or the nurse specialist. For medical technician, we provide dual track system to advance either management or specialized research and development. This is for the hospital quality manager. Chang'an have both administrative and professional track for quality manager. After 6 years, they can become the leader of this section. How much we invest in employee program provided in 2023 for medical conference and continuing education, supporting both domestic and international learning opportunity for our employees. We provide competitive compensation and benefit. This table highlights salary adjustment and the year-end bonus over the past 5 years, showcasing that Chang'an's commitment for fair compensation despite external challenges like a pandemic and the medical personnel shortage. Additionally, our competitive compensation and benefit extended to comprehensive health checkup package, proactive occupational health plan, and we also try to reduce injury through regular workplace assessment. We all know that post-pandemic healthcare workforce shortage is a very significant issue in Taiwan. So, talent retention is very important in healthcare system right now. It goes beyond salary increment. It is about creating an environment that values and nurturing every individual. We leverage smart device and AI solution, such as a labor-saving e-nurse card, which can enhance operational efficiency and reduce workload. More importantly, we focus on creating a warm, caring workplace. We provide immediate financial reward, onboard incentive, retention bonus, flexible shift system. We also actively recruit retired professionals for a part-time job. A friendly workplace is essential for overall employee satisfaction and productivity. At Chang'an Memorial Hospital, we have invested in multiple amenities to enhance our staff daily life. For dining, we provide a wide range of dining options. We also provide a monthly meal allowance. We have a diverse vendor machine at different places. We also provide exclusive discount during special holidays. For apparel, tailored uniforms are provided to our employees, ensuring that everyone feels both professional and comfortable. We also offer uniform care service. At the 40th and 45th anniversary of Chang'an Medical Foundation, jacket and vest presented to all employees of the hospital system. We also provide family housing and single dormitory for 11,000 employees and their family. This community not only provides safe and comfortable accommodation, but also strengthens the bond among our employees and their family. For transportation, to ease the daily commute, we offer a month's transportation allowance, free shuttle service, and ample parking service for both vehicle and motorcycle, ensuring that all employees have a stress-free commute to work. Recognizing the challenge of work-life balance, we have established a child care center and an elementary school within our community. That is Chang'an Elementary School. We also provide a variety of welfare measures to increase the employee's sense of belonging, improve employee satisfaction, and strengthen employee identification to enjoy their work and to provide better medical service. Our commitment to care does not end at employment. For our retirees and their eligible dependents, We also offer medical benefit, secure housing, and institutional support. In conclusion, the new formula of healthcare workplace at Chang'an Memorial Hospital is a multifaceted strategy that integrates talent development, retention strategy, and a friendly support work environment. By focusing on sustainable development, innovation technology, and the comprehensive employee well-being, we are paving the way to a good future. Thank you for your attention, and I look forward for discussion and answer the question that you may have. Thank you.
Thank you, Dr. Wu. Excellent talk. After COVID-19 pandemic, we are now face the climate change and also the zero carbon policy. Most of the time, hospital face the shortage of manpower, especially the nursing staff. Today, Dr. Wu talking about the talent development and the retention strategy and the friendly workplace is very useful for the hospital to manage it, to compensate the manpower. Is a very good answer for most hospitals. Is there any question from the website?
Professor Chen, we will introduce the next moderator to organize a panel discussion. So let's welcome Professor Lee Sang-Dang as a moderator in the discussion section. Please.
Okay, thank you, Chairman. It is a great honor for me to moderate the discussion section. And I'm Dr. Sang-Dang Lee, is the board advisor of Tong's Taichung Metro Harbor Hospital, as well as the executive supervisor and former president of hospital, as well as the executive supervisor and former president of THQA. Here we have three panelists to express their opinions regarding the main topics of hospital management tonight. Let me have a brief introduction of our panelists to the online audience. The first one is Dr. Bachun Wang. Now he is the Vice Superintendent, Kasai General Hospital, and the Executive Director of THQA. Also, he was former CEO of Joint Commission of Taiwan. And the second one is Dr. Junmin Si, who is the Superintendent of Taipei Medical University Hospital and Director of THQA. And the third one is Dr. Jin Xu. He is the Executive Superintendent, Everett Hospital, and Director of THQA. And firstly, I would like to ask the three panelists, are there any questions in terms of the first two topics speakers? I know they will be glad to answer. And is there a question for the three panelists?
And I'm Jimin Shi from Taipei Medical University Hospital. And I enjoyed the two lectures very much, and especially for the Vice Superintendent, Dr. Wu. As Dr. Wu mentioned that the challenges for the hospital management in Taiwan is different from Indonesia. I think I agree that the most critical issue is the workforce shortage, such as Dr. Wu mentioned. And I totally agreed about the talent development, talent retention, and friendly hospital, friendly environment is very important. And my opinion that in hospital, about the hospital management, another issue that we have to do for the workforce shortage is we should simplify and automating the process of the clinical process or any process to ensure that the workflow more smooth and reducing the unnecessary human effort or human movement. Means that completing the tasks with less time and less effort. So I think that we can do more about this. And I have a small question for Dr. Wu that for the talent development, for currently the young people tell us that he only or she only want easy life. They don't want to be the supervisor that is too busy or too effort. So for this for these young people, do you have any suggestion or opinion for us, the hospital manager, the supervisor? Dr. Wu, please.
Thanks, Superintendent. A very important question. Actually, we observed that during recent years, the young generation, especially the Z generation, they consider that the balance between work and life is very important. They don't want to spend too much time only just in job, in work. So the career development program for the young generation is a critical point that we can discuss with them about their future. If they want to, what they want to become is a critical, as we discussed about their working attitude. If they want to become just a local medical doctor, then we don't expect they will spend too much in a hospital. So we just select one by one. Some may be more suitable in the hospital and others not. What we can do is, if we have a good structure, talent development program, that will attract all the more young generation will come to become what they want to become.
Yeah. Yes, thank you.
I don't know, is Dr. Wang Baqing online?
Yeah, yes.
Okay. I would like to invite Dr. Wang Baqing to give us his opinion about the first topic. Could you make a simple comparison of the challenges and the prospect of hospitals in 2025 between Taiwan and Indonesia or other Asia benchmark countries, and as a highlight for our audience?
I think as we discussed, can you all hear me?
Yes.
Yeah.
Yes, sure.
So I think now we are facing the avalanche of the manpower shortage problem. I think this situation will not be turned, easily in coming few years. So if we continue to fall in the workforce like this, so the system will not operate very well. For example, today, the National Health Insurance Bureau, they issue another policy that will change the percentage of the outpatient and the inpatient income. The chief says that the medical center should have less than 45% of the outpatient income, 55% of the inpatient income. But actually, we don't have that many beds because we don't have that many person to work. So this squeeze the hospital from both way, So the money is being cut, and the manpower is insufficient. So this will cause a big challenge to the hospital management and also to the quality and the safety. So we have to think about the other way. We need to overhaul the whole strategy because we can no more work under the previous environment. So you really need the out-of-box thinking to deregulate the many things. Otherwise, if you follow the previous thinking, you cannot survive in the future. Then second one is also about the workforce. I really cannot agree with the many specialty organizations doing, because many specialty, many professional, you need to do the brand re-engineering to re-establish your brand, so you can attract excellent people. You can attract a young man. So for us, we have not met such situation in the past as a physician or a physician manager, because the human resource engineering is a very specialized profession. We need to learn from other discipline how to do the human resource engineering, not doing the things like our traditional way. We need a new thinking, new strategy to face this. I would say the crisis, of our healthcare system. Thank you.
Thank you, Dr. Wang. And thank you for the first two panelists expressed their opinion about the shortage of manpower in the hospital. And they also expressed their ideas about how to cope with this kind of a shortage of manpower. Then I would ask the third panelist, Dr. Xu. And I know Dr. Xu has been servicing public hospitals for many years and now in charge of private hospital. He got a variety of experiences in hospital management. I would like to ask him to share his experiences in the handle of hospital manpower, especially the shortage of nurses, pharmacists, and medical specialists. I also wanted to learn his ideas about the friendly workplace in hospital. And Dr. Xu, please.
Thank you very much. And I also thank you the so many expert presentation. I truly appreciate the valuable information you have shared. As I have been working in the public hospital, the government hospital, and now I in the private hospital, there has many difference in the manpower retention. As Dr. Wu said, we have seen the Linkou, Chang'an has many sources for retention the employee. But in the government hospital, it is impossible to do so many things. But I think make a friendly workspace is both possible in government hospital and in private hospital. The most important is the value of the employee who can share in his working, not only the salary. But I think it's very difficult. As the Dr. Wang said, in the human engineer, it's very deficient in Taiwan. So in the last 3 years, I have expansion many attention to make a culture of our hospital, but it's not very effective. So I still have a question for Dr. Wu. do you think what is the best practice for improvement employee retention in your hospital? I think I saw there has many face and method for retention the employee from he become working to he retired. But can you give me your experience? What is the best practice for improving the employee retention? Thank you.
Thanks, Superintendent Xu. Question. I think for the doctor part, in Chang'an, we do have many resource in their career development. Like you want to do the research, you want to do the education, you can do everything you want. So it's very free in Chang'an. You can not just contribute your medical excellence, but you also can develop your self skill in anything you want. So that's our good opportunity to recruit many very excellent employee in the doctor part. For the others, I think the most important is our hospital provide everything they need in their daily life. Like if they don't have a house, we provide family housing. If they are single, we have a single dormitory. They are very, very easy for them to have their housing. And also, they don't worry us beyond the work. They just come, then we will take care of everything for them. Also, our founders think that this hospital need to take care not just the patient, but our employee. So when we are talking about the patient center, our founders think the most important is our employee. So he invests a lot of money just to improve our employee care. So many our employees just come to this hospital because of the value of Chang'an, not just a job for medical care. So I think like you say that a culture of one company is very essential, not just the salary, not just the year-end bonus. I think if we hold the same value, mission, and vision, they probably can hold the whole company employee together. That's why I think in this year, in Lincoln, we have just a small part of the manpower shortage. I think that's maybe our answer for this question. Thank you.
Thank you very much. I am very agree your sharing because I have recently I have a doctor from the Lincoln Chang'an, and he given me the same information because in our hospital there has many shortage of the sausage like the transporter and the others. So very thank you your sharing. Thank you.
Thank you.
Okay, now I want to ask Dr. Wang, because he's in the board of ASQA, and he knows many things about the Asia countries, situation. So is there any question for you to ask Dr. Hanny regarding his topic tonight?
I think all the Asian hospitals, you know. So we are facing the same problem. Okay, so I think the aging population, the low birth rate, and the manpower shortage, the crises are global, not only in Taiwan. We are just more severe problem, you know. But in other countries, they have similar problem. But you know, since the countries, you know, varies from their economical level and the territory. So in Indonesia, probably because there is a big country, you know, with thousands of islands, you know, so they have an accessibility problem, and the different the equity issue in the hospital setting. So this problem in Taiwan and in other developed country has less problem because their healthcare coverage are more extensive. In other country, you know, although we are developing the smart healthcare, I think those countries around us are quickly developing the smart healthcare solution to upgrade the healthcare for the future demand of the population. So that's my comment. Thank you.
Okay, thank you, Dr. Wang. Is there any question from our panelists or our audience regarding tonight's topics?
Professor Lee, I'm Dr. Huang. I have a question for the Professor Ronosulistyo. Yes, thanks for your participation in our webinar. So, do you think in Indonesia is there a difference hospital manager between Taiwan and Indonesia? Thank you.
Thank you. Yes, I want to apologize about the slide because it's improper slide. I think the problem mostly is the same, but it's rather severe because we are so heavily populated and we have such a difficult transportation with 17,000 islands and shortage of medical doctors, specialists, nurses, and in hospital. What we do is we are trying one new system that teaching of the medical doctors use university-based. Now we are combining university-based and hospital-based. So most hospitals that are they are allowed to do to make medical trainings just like in Germany. So the advantage is that the doctor get salary, they got paid. If in university based, they have to pay, so they don't have anything. And it's, as we know, the medical training is very long time, so it's a very high burden to the students. So we try with the hospital-based system. Also, we have pushed the hospitals to use e-medical record. In 2023, all the hospital must use, but we cannot push it. It's maybe 80% of the hospitals that use e-medical record, although it's starting medical record or it's a profession medical record already. We also push about accreditation. In 2023, all the hospitals, maybe 95% is being accredited already. And in 24, 90% of the primary healthcare is already accredited. We have many things to do. also we have to take care of the medical, so the medical can be produced in country, so it becomes very easy. Or problems, the basic problem is universal health coverage. As you know, universal health coverage in Indonesia is very spread until 95% of the people is joining the universal health coverage. But of course, because the shortage of money and the some of the people, so it's very very cheap. The doctors are very paid. They are paid cheap, not just like in Canggung Hospital. So it's very different. But by this universal coverage, we help a lot of people. All the hospitals is packed up with patients because the patients, about 100 million patients are paid by the government. So they are categorized the poor. So the hospitals is working very hard with that small kind of money. Thank you.
Thank you, Dr. Hanny. Can I ask you a question? As
Yes.
You told us your government is planning to hospital to install the e-medical record in the hospital. So you are going to have a digital transformation in the hospital. And as Dr. Wan says, you have thousands of islands in Indonesia. So is your government decided to have teleradiology or telemedicine or even teleconsultation between the doctor in the hospital and also the small island in the other area? And then they have, the doctor or the specialist in the hospital, they can consult with the small clinic in the island. Do you have this kind of planning of telemedicine?
Yes, thank you. We work very hard for telemedicine because it's the future. Because we are so spread out with the thousands of islands, and we have also problems with the internet. Yeah, but now we are working very hard to put satellite for internet. So because telemedicine can do nothing without signal internet. So doing very hard to get 5G to all the places in Indonesia. Yes, telemedicine is built very significantly, but we are on process. Thank you.
Okay, thank you. Is there any question more from the panelists or audience? If there is no more question, then thank you for your listening. I would like to pass my moderator to the next moderator, Dr. Huang Wei-Chun, please.
Thank you, Professor Lee, and thanks for all your participation for tonight's webinar. So tonight we will focus on hospital management. We have an expert from Indonesia, Dr. Hanny, to show the change in the perspective in Indonesia hospital. And also the second topic is Professor Wu mentioned about the new formula of the healthy care workplace. I think I hope you have a very fruitful night. And next, 下一张。 So we are very appreciative for your attendance. So welcome to continue to join our webinar, international webinar, to improve the quality care of health or hospital in the world. Thank you. Good night. Professor Hanny, thank you so much. Good night.
Okay,
Yes,
thank
thank
you.
you.
Bye-bye.
Good night.
Good
Bye.
night. Thank you. Bye-bye.
Prof.